An anatomy question. The ureters enter the bladder through which of the following? Answers were given: apex, upper aspect of base, lower aspect of base, inferolateral surface, and the last one is superior surface. Bladder is a retroperitoneal organ and is the most anterior viscera in pelvic cavity. When empty, it is entirely situated in pelvic cavity. When full, expands superiorly into abdominal cavity and lies adjacent to anterior abdominal wall. The empty bladder is shaped like three-sided pyramid. It has apex, the base, superior surface, and two infralateral surfaces. The apex of bladder is directed towards the top of pubic symphysis. And the two infralateral surfaces of bladder are cradle between levator ani muscle and obturator internis muscle. The triangular shaped area that is called base or fundus faces postero-inferiorly. The two ureters enter the bladder at each of the upper corners of base, and the urethra drains urine from lower corner of base inferiorly. The superior surface is slightly down when the bladder is empty, and it will balloon upwards as bladder fills. When we come to the relations of bladder in pelvic cavity, the bladder is related anteriorly to pubic symphysis and posteriorly in males to rectovesical pouch and rectum. And in females, it is related to vesicouterine pouch, the uterus, cervix, and vagina. And bladder is related inferiorly to prostate and pelvic floor in males, and in females, it's related to pelvic floor. Superiorly, in males, it's related to peritoneum, and in females, it is related to uterus and peritoneum. The bladder receives its innervation from parasympathetic, sympathetic, and pudendal nerves. Bladder receives efferent sympathetic fibers from hypogastric plexus T12 to L2, and bladder receives its efferent parasympathetic fibers from pelvic splanchnic plexus, that is from S2 to S4. And voluntary external urethral sphincter is innervated by pudendal nerve that's come from S2 to S4. General visceral afferent fibers from bladder are stimulated by distension of bladder when it is filled with approximately 300 milliliters of urine. Those stimulations are conveyed in both sympathetic and parasympathetic nervous system. At low bladder volumes, afferent firing is low. Sympathetic stimulation keeps the detrusor muscle relaxed and keep the involuntary internal sphincter closed, inhibiting bladder emptying. That is called storage phase. At high bladder volumes, afferent firing is increased, causing conscious sensation of urinary urge. During maturation, parasympathetic stimulation causes detrusor muscle to contract and involuntary internal sphincter muscle to relax, facilitating maturation. The somatic external urethral sphincter is consciously relaxed during maturation. In spinal cord injury, there are two types of clinical syndromes are seen. For that, we need to Now about spinal reflex. The bladder stretch reflex is a primitive spinal reflex where a full bladder detected by stretch receptors in bladder wall activate visceral afferent, resulting activation of parasympathetic efferent fibers, which causes contraction of detrusor muscle and relaxation of internal sphincter. Normally, this spinal reflex is overridden by higher centers in brain to give voluntary control over maturation via external urethral sphincter. In spinal cord injuries, where the injury is above the conus medullaris, that is above vertebra level of T12, the S2, S3 and S4 level of spinal cord are intact, and there would be a functioning spinal reflex. In this case, reflex bladder will occur where there is loss of higher control, so the bladder stretch reflex takes over and detrusor muscle is stimulated to contract the bladder fills. In this situation, patient can't control his maturation. In injuries affecting the S2, S3 and S4 sacral nerve roots, that is the injury below the level of T12, the flaccid bladder will occur, where there is loss of both higher control and spinal reflex. In this situation, when the bladder fills, it becomes abnormally distented until the internal and external sphincters are stretched, allowing urine to pass. Those are two situations of spinal cord injury. When we come to the question where they are asking the entering of ureters at which level, the answers were apex, which is directed towards the top of pubic symphysis, and the next two answers are upper aspect and lower aspect of base. So the correct answer is upper aspect of base, where lower aspect the urethra will connect inferiorly. And the next fourth one is superior surface, which is a dome shape side. And the next one is infralateral surface. There are two infralateral surface are cradle between levator muscle and internus